let's talk about the role of acetyl L-carnitine in the treatment of depression. Acetyl L-carnitine, or LAC, is an acetyl derivative of L-carnitine, and that's a compound that's found in plasma and body tissues. It's known for its involvement in all kinds of metabolic processes in the body, and it has neuroprotective properties. So LAC plays an important role in the transport of certain substances, such as activated long-chain fatty acids, into the mitochondria for cleanup. So these are not great compounds. They need to be cleaned up by the mitochondria. And carnitine also assists with transferring toxic compounds out of the mitochondria. So it takes things into the mitochondria for cleanup, and it helps to clear them out of the mitochondria. Carnitine, along with LAC, pass through the blood-brain barrier, so they can get into the brain and they accumulate in the cortex. And LAC is important in the brain for metabolic processes. It modulates glucose metabolism, it stimulates glycogen synthesis, it increases plasma ATP concentration. It also improves neurological functions. The exact mechanism of LAC is not completely understood. What exactly does it do, or how exactly does it manage depressive symptoms? We don't really know that. But the hypothesis is that it is involved in neuroplasticity, in neurotransmitter regulation, and upregulation of glutamate receptors. LAC has neuroprotective, anti-inflammatory, and antioxidant properties, and those may also improve depressive symptoms. Lower LAC levels were reported in patients with depression and with treatment-resistant depression compared to controls. And studies have shown that lower LAC levels are associated with greater severity and earlier onset of depressive symptoms, suggesting that there's a role for LAC supplementation in preventing depression and treating depression. Meta-analyses have demonstrated that LAC significantly decreases depressive symptoms compared to placebo, and the rate of side effects is about that or lower than that of antidepressants. In animal model research, we found out that LAC rapidly improves depressive-like behaviors, it restores glutamate levels, and it increases expression of glutamate receptors through epigenetic modifications. And individuals with depression with lower LAC levels and elevated inflammatory markers might be the best candidates for LAC supplementation as an add-on to treatment with antidepressants for depression. We don't know as much about using LAC all by itself on its own for the treatment of depression. So overall, LAC holds promise as a natural treatment for depression, and it offers potential benefits with relatively few potential side effects.